So the meeting is going to be super exciting, especially coming off of the heels of ESMO. There's going to be a handful of prostate cancer trials that are going to get presented. And it'll be really exciting to hear the debate about some of those studies. There'll be data from the Radicals RT trial, final kind of survival data and outcomes data that are going to get presented. There's also going to be data on AMG 509, which is a bispecific targeting STEAP1 and CD3, some early data, see sort of the latest and greatest treatments in prostate cancer. Additionally, there'll be some exciting data that are going to get presented on from the Embark study. We're going to see the quality of life data get presented. We've all been awaiting that data to see just what the role of enzalutamide is in the BCR setting and the impact that it may have on quality of life. Just a lot of really exciting. There'll be subset analyses from STAMPEDE, additional subset analyses, looking at a path AI prognostic biomarker that is going to be applied to the STAMPEDE DOSI and ABBY cohorts. That'll be super exciting. And then there's also an abstract that'll be dovetailing on incidence of fractures that require hospitalization from STAMPEDE. So a lot of really interesting data that are going to get presented, and it's going to be exciting to have us all kind of debate and understand how these new data impact the field. One of my favorite Uromigos episodes was the episode where they had Dave McDermott join to talk about treatments of favorable risk renal cell carcinoma, and it was just such a comical podcast, and the bantering back and forth between David, Tom, and Brian was just spectacular. So I have to say, I really enjoy when Dave McDermott's on. The other episode that I really enjoyed was the debate between Meredith Reagan and Dave McDermott, looking at IO and IO-VEGF strategies. I think it was episode 251. That was really enlightening. Last year's conference was really just awesome. The design of the whole conference, the hot boxes that were being passed around, the mics at the meeting were not true mics, but they were kind of these boxes that would get thrown around the room. And that was always fun to kind of have the hot debate. The buzzers was a great addition to the meeting. People getting buzzed on stage, regarding whether the audience that was in the room kind of aligned or didn't align with sort of their commentary. So it was a very enlightening meeting, and just a lot of fun, engagement, really talking about the data, talking about the science, but really about, how do we interpret this? How do we apply it to the clinical setting and make sense of it in the real world? And I think that's what's so great about the Uromigos platform, is the application to just real world clinical practice, and not necessarily just getting in the weeds of data per se, but what do I do on a daily basis?